Have you ever looked at a really brilliant, life-changing piece of technology and just wondered, why isn't everyone using this? Well, today we're diving into a really fascinating paradox in the world of health tech, especially when it comes to technology for our aging population. There's this huge gap between what the technology promises and who's actually using it. So let's dig in. Okay, so on the one hand, you've got these incredible virtual coaching systems, or VCSs. I mean, just imagine an AI health coach right in your pocket. It's giving you personalized advice on everything from what you eat to how you exercise, all designed to support healthy aging. The promise here is just massive. But the reality? It's kind of a letdown. Adoption rates among adults over 60 are just nowhere near where you'd expect them to be.
And that's really the central question for this whole explainer. It's not as simple as saying, oh, older people just don't like new technology. The real answer, as a recent study uncovered, is so much more complex and, honestly, a lot more interesting.
To solve this puzzle, the researchers started where you'd expect. They looked at the usual suspects, the common sense reasons why anybody decides to use a new piece of tech. Their starting point was this classic framework called the Technology Acceptance Model, or TAM for short. Now, this thing has been the go-to theory for decades, and it's built on a really simple idea about what makes us tick when it comes to technology. So the model basically boils everything down to two fundamental questions we all ask ourselves, usually without even realizing it. First, is this thing actually useful for me? Will it help me? That's what we call perceived usefulness. And second, can I figure this thing out without a huge headache? That's perceived ease of use. If the answer to both is a solid yes, well, you're probably going to use it. Makes sense, right? And sure enough, a study of 436 Italian adults confirmed that, yep, these two things are absolutely critical for getting older adults to use a virtual health coach. No big surprise there, but this is where it gets good, because this is where our investigation really begins. The most revealing findings were hiding just beneath the surface. So let's get into the surprising truths that the researchers uncovered. This is where we go way beyond the obvious stuff and see what's really driving, or in some cases, blocking people from using this tech. All right, so the first big plot twist has to do with something we all assume is a huge motivator: peer pressure, or in this case, what our family, friends, and even our doctors think. Now, check out this direct quote from the study. It says, "Subjective norms are not found to have a significant direct impact." Whoa. Subjective norms is just the fancy academic term for the influence of those people around us. So what this is saying is that their influence doesn't have a direct impact. In other words, your doctor telling you, hey, you should really use this app, isn't enough on its own to make it happen. See, the influence is way more subtle and indirect than we think. The opinions of others only seem to matter if they actually succeed in changing a person's core belief that the tech is genuinely useful or that it's actually easy to figure out. The recommendation itself isn't some magic bullet. It's all about changing those two fundamental perceptions we talked about earlier. And that brings us to the second twist, which is maybe even more counterintuitive. I like to call it the expert's dilemma. This one is all about what happens when the potential user already knows a lot about their own health. So the study looked at something called health literacy, which is basically just how good someone is at finding, understanding, and then using health information. Now, you'd think that people with high health literacy would be the first ones to jump on a new health app, but what the study found was this really strange paradox. And this is where that paradox becomes crystal clear. On the one hand, you can see this first bar shows a positive impact. People with high health literacy thought the tech was easier to use. That totally makes sense, right? They're comfortable with the concepts. But then, look at that second bar. For perceived usefulness, it's a negative impact. They actually found the tech less useful. How does that even work? Well, the researchers' theory here is just fascinating. It seems that people who are already really health savvy look at a virtual coach and think, I don't need this. I already know how to manage my own health. They see it as a tool for beginners, not for them. So ironically, their own expertise becomes a barrier to them using it. Okay, so we've kind of untangled this mystery, but the real question is, what do we do with this information? Let's turn to the final lessons and see how we can turn these insights into some practical advice for actually getting these good ideas off the shelf and into people's hands. So the study lays out a pretty clear roadmap. First off, designers have to aim for radical simplicity to nail that ease of use factor. Second, to prove it's useful, they need to share success stories. You got to show people the benefits, not just tell them. For those health experts we were talking about, you have to show them what the app can do that they can't do on their own, maybe by using smart AI for truly unique insights. And finally, for the bigger picture, policymakers can step in and create programs that help boost everyone's digital skills. You know, this whole focus on hidden, indirect factors gets you thinking about a bigger question. This first study showed us how our own beliefs and subtle social nudges shape our tech choices. But what if this idea applies even more broadly? What if some of the most powerful things affecting our health have, well, nothing to do with healthcare at all?
And it turns out that's exactly what other research is discovering. Sometimes the most powerful health interventions aren't even labeled health to begin with.
Just take a look at this powerful example from a completely different world. A recent study looked at China's low-carbon city policy. Now, this was an initiative aimed at fighting pollution, right? Reducing industrial emissions. The goal was purely environmental, but the result was this surprising and huge public health win. Cleaner air led directly to better fertility and maternal health.
And this wasn't just some vague things got better situation. The data was super specific. In the cities with the policy, there was a 1.4% increase in the average gestational age of pregnancies. Now, 1.4% might not sound like a lot, but in public health terms, that's a significant drop in the risk of preterm births, and economic policy for the environment was directly leading to healthier babies.
And that's really the big idea that connects everything we've looked at today. Whether we're talking about the subtle psychology of why a health-savvy person might ignore a health app, or how a clean air policy can boost maternal health, the things that drive our well-being are incredibly complex, they're all interconnected, and they are very often surprising.
It really makes you wonder, doesn't it? If an environmental policy or even a person's own expertise can have such a profound and unexpected impact, what other invisible forces are out there quietly shaping our health every single day? That's a question worth thinking about.